guys, my name is Dr. Anne-Marie Barter, and today we are going to talk a little bit about small intestinal bacterial overgrowth, which is SIBO. So SIBO happens when there is a large variety of bacteria in the small intestine that leads to various digestive issues: bloating, diarrhea, constipation, malabsorption syndrome. A summary of the key causes of SIBO are motility disorders, low stomach acid, systemic issues like chronic diseases, hormonal and endocrine imbalances, bile deficiency, dysbiosis, which is an imbalance of your gut bacteria, parasitic infections or pathogens in the gut, medications, and then some chronic conditions like IBS. So one of our first causes of SIBO is impaired motility. So this is where the small intestine's muscle contractions are weakened, or they can stop altogether. Food that just sits there and becomes stagnant, and then a buildup of bacteria. So for motility issues, I'm not going to go through the complete list of what causes it, but one of the big ones is actually electrolyte imbalances, specifically potassium, calcium, and magnesium, because you need these for the smooth muscles in the gut and their contractions. So having enough of this is going to reduce the amount of bloating and constipation overall. So it's really important. And I'm not going to get into the details of each individual one, but one thing that I do use quite a bit is something called electrolyte support. This has caffeine in it, so some people don't like that, but I do think it works. I think it works if you use it for 30 days, that you build these up, however works for you. I've seen some electrolytes on the market that I don't really think move the dial as much as I would like to see on lab work. So if you could just get lab work maybe run pre and post, there are functional levels that I do still see, even if you're within range but you're functionally low, people can have problems. So I'll put a link to the electrolyte that I use below called electrolyte support, but whatever works for you, and definitely get your blood levels checked if you feel like you're having this issue. Okay. If you do use mine, I would say to use it daily in the morning for 30 days and then as needed for heavier workout days or heavier sweating days, because that's where we lose electrolytes. Okay. So the second issue is hormonal imbalances and endocrine disruption. So there's quite a few that can contribute to this, but the one that I most commonly see is hypothyroid or low functioning thyroid levels. When you have this, it slows down many psychological processes in the body, right? Because the thyroid controls the metabolic rate of your body. So this includes gut motility, which can result in constipation, bloating, and slow digestion. It can also relate in slower bile contraction because the gallbladder is going to slow. Certain medications will also cause issues. For example, antidepressants, proton pump inhibitors, known as PPIs, opioids, calcium channel blockers, those are commonly used to treat blood pressure. So another contributor that we definitely see with causing SIBO is low stomach acid, or it's called hypochlorhydria. Stomach acid plays a huge role in preventing bacterial overgrowth, keeping parasites out of the gut, keeping pathogenic bacteria out of the gut. So when stomach acid levels are low, the barrier that normally protects the small intestine from bacterial overgrowth is weakened. And so some things that are going to reduce the amount of stomach acid are going to be those PPIs, again, the proton pump inhibitors, which are commonly used to treat acid reflux. So that can certainly lower your stomach acid production, and it's going to increase the risk for SIBO. I've also seen an H. pylori infection. It's an infection that lives in your stomach, and it's known to cause ulcers, and it can contribute to downstream effects like SIBO because it's going to alter your gut bacteria and the gut microbiome. So clinically, I see this a lot when I run stool testing, that there will be a SIBO infection, an H. pylori infection, potentially a parasite infection. So there's other contributing factors that can happen. Okay. Another issue that can contribute to SIBO is going to be the chronic use of antibiotics. That's going to disrupt the normal balance of gut bacteria, and that leads to the harmful overgrowth of bacteria. You have to properly re-inoculate your gut. So it's really important so that SIBO does not come back. The next thing is your gallbladder actually is very important to keep SIBO at bay, but a lot of times you're gonna see that the bile is reduced into the small intestines. and that can contribute to having more SIBO. Some people have gallstones, some people have sludge. Bile acts as our natural antimicrobial. I find it so much on labs that the gallbladder is a little bit backed up. So if SIBO keeps coming back, you have an upstream problem like maybe some other infection, or it could be an issue with the gallbladder. And this especially happens with women because of our hormone fluctuations. It can be pretty hard on the gallbladder. The next one that we see is intestinal dysbiosis, which is an imbalance of your normal gut flora. So it can be a lot of bad bacteria and not as much good bacteria. And that comes from poor diet, stress, antibiotics, usage. And so the bad bacteria basically outnumber the good ones. I've also seen in this that we can have parasitic infections, we can have pathogens, and all of these things are going to create an environment that is more suitable for SIBO. And then when someone has been diagnosed with irritable bowel syndrome, I generally see that SIBO can run hand in hand with this. So they're often associated together, that can be an underlying contributing factor to SIBO is IBS. So some of the factors that can contribute are going to be, dysbiosis, motility disorders, and so these are definitely going to allow SIBO to grow. When I treat SIBO, I personally use antimicrobial herbs, and I build the gut back ASAP. This is kind of a balancing act because there's a lot of people that have increased their fiber, or they've increased their probiotics, and they feel much worse. So we want to make sure that we do this low and slow, because we do want to kill off the SIBO to a point where we can build up the rest of the gut. When I suspect SIBO, I personally run a stool test. Now, this is not the gold standard for treating SIBO. It's a SIBO breath test, but you get so much more information from an overall perspective of what's going on in their stool testing, so that you can treat other causes that could be contributing to SIBO, like we talked about above. This is just a run-of-the-mill SIBO infection. So just for simplicity of this video, what I'm going to do is I start with something called microbe support, and I can link this down in the bottom, but I start with one per day, and I start away from food, and I do one per day for the first week. And the reason for that is because the die-off can be significant. Headaches, muscle pain, fatigue, you can have an increase in bloating. And then on the second week, I'm gonna have someone do one in the morning and one in the evening. And so they have to be eliminating, and if the die-off becomes too severe, I go back down to one per day. So you don't want to feel terrible. Some people feel a little bit off for a couple days, but this should resolve, okay? So, and move your bowels daily. It is so important. If you're not moving your bowels daily, you have to kind of go backwards on this protocol and do less, because the die-off is going to outpace what you're getting rid of, and you're just gonna feel so sick. What we do is, if someone, I reevaluate, I see how they're doing. If in really complicated SIBO cases, I add something called SIBO B. So I start the same way. I add one in the morning and one in the evening, and it's taken with the microbe support. But I slowly add it up, so for the first week, I'll do one. Second week, I'll do one in the morning, one in the evening. I do this protocol based on their symptoms and based on how high their labs were with SIBO. Most people you can tell based on their symptoms, but I am a big fan of building the gut back as fast as I can. So as soon as I can, within the first 3 weeks, I start with something called prebiotic support. This is short-chain fatty acids known to really help to build the gut back. And I start for the first week with one in the morning and one in the evening. I make sure it doesn't increase their bloating. I make sure that they feel okay. If they can tolerate it for the first week, I do 2 in the morning and 2 in the evening, okay? After about 6 weeks, I generally try a probiotic. It works about 80% of the time. I can do the probiotic called IBS support. If you're doing pills, I do 1 starting for the first week, or if you're doing the powder packet, I do a quarter of a packet. If this increases bloating, I have them stop for about 2 weeks and then retry. If it does not create any problems, then I increase to 2 pills, and then I will also increase to half a pack, whichever way you end up going, if it's pills or if it's powder. So that's what I like to do. I think that that's a pretty simple plan. And then I start to, at about the 2-month point, I start to decrease the amount of microbe support and SIBO support, decreasing it by, 1 pill per week, just like we started, increasing it, decreasing it, and making sure the gut symptoms don't come back, okay? I also get asked about the low FODMAP diet quite a bit. This is controversial. I actually don't pull people off of all FODMAP foods. The reason for that is because I just reduce to the amount where they're having symptoms. So for example, if you eat a cup of broccoli and you have symptoms, then maybe we try half a cup of broccoli and we see what happens. How do you feel? What do you notice, etc.? Are you okay on that one? The goal is not to reduce all the foods, because then the SIBO it kind of hides and then you can't get rid of it fully. And so then when you actually start to eat those higher FODMAP foods, it all comes back. So we really want to make sure that you can eat those foods to tolerance. So if a cup of broccoli gotcha, then don't do that. The two main things that I see are the worst, and the two that you have to reduce: the garlic and the onions. Those are the two that I find that are kind of the most irritating. But if you can pare that back to a level where you tolerate, make sure you're not doing that every meal, that does help. To tolerance, and then your tolerance is going to increase as the SIBO infection dies. So you can start to slowly increase that. All right, so if you suspect you have a SIBO infection, you can hear that it's a little more complicated than just doing the antimicrobial herbs, especially if you've done treatment and it's come back. There's probably a little more of an underlying cause where a comprehensive stool panel is going to be really, really helpful to figure out what could be the underlying cause. But I hope that this helped a little bit to shed a little bit of light to kind of tell you, hey, these things could be contributing and here's a protocol that could help. All right, reach out if you have any questions and let us know in the comments below what you'd like to hear more of, and we will try to get that in the works for you. All right, thanks for listening. Take care. Bye-bye.